Hello and welcome. You're watching NewsX. I'm Devika Chopra, and in this very special segment, we have with us Dr. Shekhar Srivastav. He's the HOD for orthopedics at the Paramanand Special Surgery Hospital in Delhi. He's joining us live on the broadcast. We are discussing osteoarthritis with Dr. Srivastav. Dr. Srivastav, welcome to NewsX, sir. Thank you so much for speaking with us. I'd like to begin by asking you, of course, if you can explain to our viewers, what is osteoarthritis?
So, any problem which affects the joint is known as arthritis. And if we consider various types of arthritis, then the commonest arthritis which is affecting general population is osteoarthritis. So, osteoarthritis is basically the wear and tear of the joint because of the aging process. Now, as we grow old, there are many changes which are happening in our body. If you notice, your hair gets gray, you get wrinkles on your skin. Similarly, there are also changes happening in the joint. The articular cartilage of the joint, which normal people they refer to as the cartilage or the grease, that usually gets destroyed with wear and tear. That leads to arthritis. That is known as osteoarthritis.
All right. So, what really are the symptoms then that a person can understand that perhaps he or she is actually suffering from osteoarthritis?
Okay. Now, if we consider various joints which are getting affected, then the commonest joint again is the knee joint. Most of you, or most of the people, they must have seen elderly people who are having pain in their knee, or they are walking with difficulty, or they are having deformities in their knee joint. Okay. So all these are symptoms of osteoarthritis. So if a person starts having pain in the knee joint, he's having difficulty in climbing stairs, he's having pain even at rest, the joint is getting deformed, all these are symptoms that probably you are getting osteoarthritis. You must visit a doctor and get your X-ray done.
At the same time, Dr. Srivastav, what is the current scenario in India in terms of osteoarthritis of the knee?
Now, if we compare Indian population with the rest of the world, or especially people from West, then somehow the osteoarthritis of knee is very, very common in our population than the West population. Now, it may be a genetic factor. It may be that we are not as active as the population in the West. Though the current generation, the younger generation, is more into fitness and exercises, but if we see the elderly people, they probably were not so fit, not so active. So somehow the osteoarthritis of knee in Indian population, the percentage is much more than West. And let me put it in this context that as an orthopedician, as an orthopedic surgeon, almost 40% of my patients are knee pain, and almost 80% of them are osteoarthritis. So you can understand the gravity of the problem.
Absolutely. And at the same time, Dr. Srivastav, why exactly are women more prone to this condition?
You are very right. So if I see 100 patients of osteoarthritis, almost 80% will be women. Okay. Now, reason which attributed to this is perhaps the women, perhaps they, especially the elderly women which we see, and they were not doing exercises in their youth, in their young age, so the muscles are weak. The muscles of your thigh, the thigh muscles are the protector of the knee joint. So if your muscles are weak, then all the pressure falls on the joint, and that can lead to osteoarthritis. Second reason is that in Indian scenario, usually the girl child, the nutrition is not as good as in male child. It is because of the various factors, the various social factors which we know. And if your intake of calcium and protein is less, then that also leads to weakness of the muscles that can lead to osteoarthritis. And third thing is that perhaps is the kind of work which the ladies are required to do, which involves repeated sitting on floor or squatting. So all these activities puts more pressure on the knee joint, and that's where they are more prone for osteoarthritis of the knee joint.
Is it true, sir, that osteoarthritis of the knee is not really an age-related problem anymore?
It is, I would say it is partially true, because as I told you, the main reason of osteoarthritis is aging. But nowadays what we see that even younger people are coming to us with features of arthritis. Now, in the younger people, the reasons of osteoarthritis may be that if there has been some infection or if there was any trauma in the knee joint, any injury in the knee joint, that can predispose the joint to arthritis. So people are getting more fit, people are getting more and more into the sports also. But if there is these injuries are not dealt properly, if they are having ligament injuries or if they are having meniscus injuries, and if they are not dealt properly, then even in young persons, we are seeing osteoarthritis nowadays.
And Dr. Srivastava, does everybody then need a surgery to deal with osteoarthritis?
No, that's a misconception. So I would say that almost 90% or more than that, patients can be managed without surgery. Okay, so if a person does exercises, if there are some supplements like calcium which are good for the bone, there are some cartilage supplements. If these are taken, and more than that, if the patient do some activity modification and do exercises properly, then almost 90% of the patients can be managed without surgery. It's only the severe cases, grade 4, which require surgery. Otherwise, most of the cases can be managed with exercises and some supplements. So it's a misconception that if you have an osteoarthritis, then you definitely require a surgery. It's not like that. And even if surgery is needed, not all patients require total knee replacement. So there are some other options also. So almost, I would say, majority of the cases of osteoarthritis can be managed even without surgery.
And so essentially what you're saying is that there are some alternate ways perhaps to manage the pain, and surgery becomes the last resort.
Exactly. So it all depends on the grade of osteoarthritis. Okay, we don't see patients having same degree of osteoarthritis, and based on the degree of osteoarthritis, the treatment is determined. Most of the patients are in the early stages of osteoarthritis. So in that stage, you don't require surgery. And if at that stage, you follow some precautions, you do exercises, then the progression of disease can be slowed down. I won't say that it can be totally stopped, but definitely it can be slowed down. So it's not that surgery is needed in all cases, but yes, there are cases where the disease has progressed beyond a certain stage, where the patient has developed a deformity. You must have seen many patients who have got these bowed legs, okay, almost like a bow. Now, these are the cases which simply cannot be managed with medication. And these are the cases where surgery works wonder. It can change the lifestyle of the patient. So, majority of the patients can be managed without surgery. But if the disease is advanced, then in that case, surgery gives very good result.
All right. And also, sir, of course, our viewers would love to know what really is the latest in technology for treatment of osteoarthritis of the knee.
Okay. Now, again, it's a very broad question, and let me put some things into it. So if it's an early arthritis, then now there are some treatment patterns, like one can give PRP injections. These injections are supposed to protect the cartilage. This can be tried only in early stages of arthritis, and the results are not so predictable. Now, in advanced arthritis, if only one side of the joint is damaged, then we just go for half knee replacement. That means you don't require to replace the whole knee joint. Only part of the knee joint which is affected is replaced. That is known as partial knee replacement. And here, as all the soft tissues, the ligaments are maintained, so the recovery is much faster. And more than that, the patient feels as if the knee is absolutely natural. So it gives a very natural feeling. The recovery is much faster. So that is partial knee replacement only if a part of the knee joint is affected. But in case of severe arthritis, where total knee replacement is required, in those cases, nowadays, the robotic surgeries, it gives excellent result. Now see, what does a patient expect from knee replacement? That my knee should go, I should be able to do my activity, and the knee should last my lifetime because it's a natural knee, so it has got a finite life. So you expect that the knee should last my lifetime. Now, all this can be done if the knee replacement is done by a proper technique. If the replaced knee is placed, it mimics your natural knee and they're well balanced. Now, all this thing can be done with exact planning and accuracy by robotic technique. So the robotic technique is the newer thing which has brought quite dramatic changes in the way knee replacement is performed.
So, Dr. Srivastava, how exactly would you say, just to sum it up, how technology has been a game changer as far as the Indian scenario is concerned?
So, as far as Indian scenario is concerned, I think in medical field, the technology is keeping at pace with whatever changes is happening in other parts of the world. We are not behind the West in any matter, and whatever technology is being developed abroad is also available in our country. So in early arthritis, there are some experiments going on in stem cell therapy and PRP, which is supposed to protect the knee joint, to prevent the degeneration, so that the arthritis doesn't progress to advanced stage. Similarly, as far as the replacement surgeries are concerned, there also the technology has brought a sea change. Now the diseases are managed in a much more precise and accurate way, so that the recovery is faster, the pain is less, and the patient is back to their normal functions as early as possible. And these, so that these implants also last their lifetime. So that way, these technological breakthroughs have improved the outcomes in patients with osteoarthritis. It is happening throughout the world, and the same way is happening in our.
Also, Dr. Srivastava, you can share an anecdote with us, sir, about the oldest person and perhaps the youngest person that you've operated upon. What really were the results?
Well, the oldest one which we operated was around 90 years old, and though 90, but he was quite lively, and his only thing was that he, Dr. Saab, I want to remain active. I don't want to become a burden on anyone, and you do whatever you can. And he was quite happy with the result. He came back to us after 2 months with sweets in his hand, and he was quite happy. Now, as far as the youngest one is concerned, we try to avoid knee replacement surgery in patients who are less than 60 or 55 years of age. Okay, but then there are some conditions where the knee is very much damaged and the patient is not able to do their normal activities, not able to go to work. So those are the conditions where you have to do surgery despite lower age. So the youngest one which I have done is around, he was around 33 years of age, who had injury in his knee joint approximately 10 years before that. And he was having continuous pain in his knee joint. He was not able to go to his work. And there was no other option available. So there were two options. Either we fuse his joint, knee joint. That means there was no movement possible in his knee joint. or the second option was knee replacement. So we did knee replacement, and he was absolutely fine. He could walk normally. He could pursue his profession. And so that was the youngest with which we operated. So based on the patient's condition, we decide the treatment. There are some issues, there are some conditions where apart from knee replacement, there is no other option. So in that case, the age doesn't remain a criteria.
And so as we wrap this up, what is your advice for our viewers for management of the pain that is associated with osteoarthritis of the knee?
Yeah, so there are a few things which can be done, which can really help your knee joint and which can decrease the pain associated with the knee joint arthritis. First of all, you must keep doing some exercises, okay? Nowadays, with digital platforms like all kind of WhatsApp or YouTube and everything, you can easily find out what are the simple exercises for the knee joint. There are just 2 to 3 exercises, and if you keep doing them regularly, it really helps your knee joint. Keep your weight under check. Your nutrition should be normal. Indian diet, unfortunately, is poor in protein and calcium. So you must take your protein intake properly, protein and calcium intake properly. Do some exercises, keep your weight under check, and that will take care of most of the problem of your osteoarthritis related to the knee joint.
And Dr. Srivastav, lastly, any sort of lifestyle changes, perhaps any preemptive medication that you would recommend for the younger generation?
So for younger generation, I think proper nutrition itself is enough. And you know that in these times, with the age of Zomato and Swiggy, it's not easy. It's so easy to order food from outside. But if you take your nutrition properly, you take your vegetables and protein and calcium intake properly, that will take care of your nutrition part. And second thing which we see nowadays is the sedentary lifestyle in children's. Now, most of the children's, they are into this digital thing on the mobile or iPads or laptops, and they're happily playing some game on these devices rather than actually going down and play. So the incidence of obesity in children is also increasing. So to remain physically active is very essential, and that habit is developed from the childhood. So they should remain physically active, they should take proper diet and avoid junk food. So if these things are to be followed, then the young people can even protect the knee joint. Now, even persons who are playing sports, now this is one extreme. The other extreme is people who are into fitness and gymming. And nowadays what I see, the overuse injuries. That means, you see, if you are doing exercises, if you are going to gym, then there is some breakdown in the body. So the body also requires some rest to recover. If you do excess of exercises, even that is bad. Okay? So you should have a proper trainer. You should know when to warm up, how to cool down, how to play your sports. So that is also essential. So in young ages, in young people, we see these two extremes. One is total lack of activity, and other is increased activity. So you should know where to find the balance. Okay, so that's the challenge. But if it's not very difficult, if you take proper nutrition, if your weight is under control, you are pursuing some sort of sporting activity, you should be fine.
Well, thank you so much, Dr. Shekhar Srivastav, for joining us on NewsX and taking us through osteoarthritis, what really is it, and what is it that all our viewers really need to watch out for. Thank you so much, sir.
Very nice talking to you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.